You're watching the Wellness Hour live, news that makes you healthier. I'm Randy Alvarez. Today's topic, cosmetic surgery. We're doing the unthinkable today. Cosmetic surgery for the female genitalia. With us, we have board-certified plastic surgeon known all over the world, Dr. Neal Handel. Dr. Handel, welcome to the program.
Thank you for inviting me.
You know, I've wanted you on the show. We've had you talking about other topics, and I love your email. You said if Randy's man enough to talk about this topic.
Right.
But is there a big need for this? And
well,
define it, by the way.
You just said something interesting a second ago. You said we're going to talk about the unthinkable. You're right. Just a few years ago, this was something that nobody thought about, and it has evolved in a very short period of time, the last 5 to 10 years, to become a very important part of many plastic surgeons' practices, and it's been so helpful to so many women who are now finding that things that they were embarrassed about, that they were maybe even afraid to talk to their moms and their doctors about, now can be fixed. And I can tell you some of the common things that plastic surgeons who are properly trained in this area do to help patients feel better about the way their vaginal area or genitalia look. And that's important.
Okay.
I mean, the aesthetics of that part of the body is important to many people. One of the commonest things that we see in young women or in women who've maybe had 1 or 2 babies is that the internal lips, what we call the labia minora, the internal vaginal lips, become elongated. They can become very hypertrophic, very large, very thickened, and that bothers patients. They can have physical symptoms. Some of them have pain. Some of them have difficulty with intercourse. Okay. They can have an embarrassing problem that when they're wearing a swimsuit or shorts, the labia is actually protruding out and can be seen. Okay. This is really causes a lot of distress in young women.
These women before, they would go to their gynecologist. In fact, I see it advertised as cosmetic gynecology.
Well,
but is that who they used to handle this or no?
Okay, well, gynecologists do some of this.
Okay.
There's no doubt about that. And I'm sure some of them do it well. But, and I don't mean to disparage an entire specialty, but gynecologists often used a very primitive technique where they simply amputated the labia, just like cutting someone's ear like this to make the ear smaller. That's not the way plastic surgeons do it, at least not the way I do it. We actually do a procedure where we're very careful about how we design the wedge of tissue that's going to be removed, and then we rotate and reposition the remaining tissues to create a normal-looking labia minora. The inner lip looks like it looked before surgery, but it's smaller. And instead of having a long scar along the entire edge of the labia, there's just a tiny little scar, which gives much less chance of having pain in the area after the surgery. It's just aesthetically night and day.
In your email, you called it youthful appearance.
Correct. Because
is that what you're trying to do? Make it look younger, mimic?
Absolutely. Because if you look at the genitalia of teenage women, young women in their late teens and early 20s, particularly who haven't had pregnancy, they have a certain proportion. The labia minora usually protrude just a little bit more than the labia majora. They usually have a nice shape. They're symmetrical looking. What we sometimes see in women is that they're very asymmetrical. That can even occur in young women. I've seen 17, 18-year-old women who one labia hangs down 2 inches. That bothers them. They're embarrassed about the way they look. And it's very uncomfortable. But in women who have children, there's a propensity, a tendency for these tissues to stretch out as other parts of the body stretch out, to hang down. And I can tell you that it has been, in my practice, it's often an add-on procedure. Women will come in about their breasts and they'll go, oh, by the way, something that kind of bothered me, but I never said anything is, my labia don't look good. And I go, well, let me take a look. And they go, can you do something to fix that? And I go, absolutely. We'll do it when you do your breasts. We'll do it when you do your tummy.
What about sensation?
It shouldn't affect sensation. The way that it was done in the olden days, 6, 7 years ago, before these newer techniques were developed, the amputation of the labia
but
did
you're
change
still cutting
sensation.
it, by the way.
You are, I know.
So it is amputation still.
Think about this. Think about your tongue being too big. Okay. If you want to reduce the size of your tongue, is the smartest way to do it to just stick it out, pull on it, and cut it across, or to take a triangle out of it, carefully reapproximate the edges to restore the anatomical shape of the tongue. Which of those operations is going to give you better function, better scarring, and better sensation? The one where you remove the wedge of tissue, carefully reattach everything back into its anatomical position.
Okay, and this is the training of a plastic surgeon.
These techniques.
So you do this with skin, anyway, or tissues.
Right. This was a natural for plastic surgeons because we have a history for the hundreds of years that plastic surgery has been a specialty of rearranging tissues in the body to restore normalcy or to improve the cosmetic appearance. So it was a natural for plastic surgeons to get into this. They have, and I think that plastic surgeons, some of them colleagues of mine that I know very well, have been instrumental in advancing the technology in this type of surgery. Doing it? About 10 years now.
Oh, is that right?
Yeah, about 10 years.
How do people hear about this? I mean, they Google you.
You know,
it's listed
it's
on
interesting.
your website?
It is on my website, but I'd like more people to know about it because I think there's hundreds of thousands, probably millions of women out there that don't even realize that there are great, safe, relatively inexpensive surgical procedures that can fix a problem that may have been bothering them for decades. I mean, this is something we do on an outpatient basis. We do it under general anesthesia usually for the patient to be comfortable. They go home that day. They can go back to most of their normal activities within a matter of a day or two. Sexual intercourse, we want them to refrain from about 6 weeks to avoid, damaging the area.
What about laser?
Some doctors use laser. Some gynecologists.
I think I heard somewhere that laser is the way to go.
Laser is just there is just a tool. It's not a procedure. You can use lasers for cutting. I use a brand new instrument that I think is even better than laser. It's called the plasma knife. It's a radio frequency knife, and it is perfect for these kinds of procedures.
You're heating the area like a laser.
We use this with a plasma blade. You don't heat the tissues the way some of the other modalities used for cutting, such as the cautery or the laser did. And it's going to really revolutionize surgery. I've actually just started, it's funny you should mention it, I've just started using it within the last few weeks, but it's incredible. When you use the typical cutting devices for tissue, the tissue goes up to something like 1,800 degrees. With this plasma knife, the tissue temperature goes up to like 130 degrees, so there's much less tissue damage. But I want to that was a little bit of a diversion, and I'm glad you brought it up. I also wanted to talk about other things that we can do in the genital region to improve the cosmetic appearance. As women get older, and we talked about young women sometimes who have problems, or young women who've had a few children, but older women often have loss of fatty tissue in the labia majora, the outer lips, the area around the vagina. And that can be very distressing to them because they've got the kind of hanging, wrinkled skin. There's two ways that can be treated. One is with fat grafting. We can transfer fat from other parts of the body into the labia majora to fill them out. It's more youthful. I mean, when you're young, your body has subcutaneous fat in all the right places. And as you get older, things sag and fat atrophies. And it happens in the face, it happens in the breast, it happens in the buttocks, and it happens in the genital area. So fat transfer is another modality that we can use to improve the appearance of that area.
And we have about a minute left.
Okay, and then one other thing I want to mention is there is a role for liposuction as well. Many women, especially those who have a lax abdomen, have a protuberant or hanging mons pubis. So the mons hangs down over the vaginal area. That's very distressing to them. It doesn't look good in clothes or out of clothes. We could treat that with a combination of liposuction and a pubic uplift, often done in conjunction with an abdominoplasty. Kind of get rid of the redundant skin and lax tissues from above and tighten up and uplift and reduce the bulkiness of the mons and really have a fabulous result.
And is this one of those things that women confide in you that have bothered them for 10 years, 15 years, 20 years?
Absolutely. I mean, it's amazing because it's a part of a patient that very few individuals besides herself ever see. But if it impacts somebody's self-esteem, it can bother you every living conscious minute of your day because it's your body, it's who you are, the body that you inhabit. And I can tell you that the patients I've done have, to a woman, been happy with the outcome. Absolutely.
What are the price ranges across the country from the lowest that you've heard or seen?
It would depend a little bit on the city because the costs of operating facilities and anesthesia vary from place to place. But I would say to give a range probably between $4,000 and $8,000 would be a typical range for including the surgical procedure, the facility, and the anesthesiologist's fee.
Okay, good. Yeah. So this is obviously a very private procedure. What to look for in a doctor that's doing this, somebody that has some experience, you've been doing it for 10 years, somebody
who has the experience, the knowledge to make the proper diagnosis, and somebody who has the confidence. I think that usually comes across in the consultation. Patients can usually tell by talking to the doctor if he really feels confident and knows what he's talking about. I mean, another thing is to say, let me see pictures of other patients you've done. We all have photographs of our own cases.
Okay.
If we've done a lot of cases, they should ask for that. Want to know what the incidence of complications are. How would the complications be handled? Maybe even talk to a patient. Most plastic surgeons, certainly myself, I'm more than happy, and my patients often volunteer. They say, when, you know, let me talk to other patients that want to have this done. I'm so happy with it. I'd like to help other women.
All right. Well, I want to thank you for coming on the show. Very interesting.
Absolutely.
Very interesting.
Yeah, my pleasure.
So thanks. We'll have to have you back about some other topics.
Okay, great. I appreciate that.
You've been watching the Wellness Hour Live. I'm Randy Alvarez. We'll be right back.